are so glad that you have joined us for the course, Foundations in Evidence-Based Practice in Healthcare. Evidence-based practice is a problem-solving approach to the way we deliver care that integrates the best evidence from well-designed studies, combines it with clinicians' expertise, and a patient's preferences and values. When each of those components integrate together, we deliver the best care. However, to sustain evidence-based practice, we need to live in cultures and environments that support clinicians to practice in this way. This course will take you from a way of delivering care that might be based on tradition, like my button says, because we've always done it that way. But in evidence-based practice, we don't talk that way anymore. So moving from outdated or traditional types of practice to that which is based on the best evidence. So the first talk, the first lecture in this series is going to first make the case and provide you with all the data as well as get you emotionally triggered to want to change the way you practice to the best way of practicing. Emotion is what often helps people to make a change because we're talking about behavior change. Many people didn't grow up with skills in evidence-based practice. They grew up with, this is the way we learned it 10 or 20 years ago, and that's the way we do it here. So we're going to try to raise your emotion and give you a compelling reason to change to an evidence-based approach to care. Secondly, we are going to take you through the steps of evidence-based practice. We are excited about giving you all our expertise, all the data-driven methods that work best in implementing and sustaining EBP in healthcare systems, and getting you very excited about taking this back to your practice settings and helping other colleagues to practice in an evidence-based way. My colleague, Dr. Lynn Gallagher-Ford, who I've had the privilege of working with over the past several years, is a top-notch expert in evidence-based practice, and Lynn will be conducting this particular course with me. I'd like you to meet Lynn now and hear how excited she is to join me in the offering of this evidence-based practice course for a variety of clinicians from different disciplines and healthcare providers.
Thank you, Bern. I would like to just welcome everybody to the course, and I wanted to share with you not only how excited I am about sharing all that we have come to know and be able to teach about evidence-based practice in ways that really work. What I also bring is about 26 plus years of nursing experience in clinical settings in the real world as a nurse administrator. So one of the other things we're going to be able to talk about is how do you make all of this really possible in real-world settings with all the challenges that are out there in healthcare these days and the barriers that we know about and the barriers that we found strategies to break through? And what are some of the emerging barriers and strategies? So it's not just basic information, but we're really going to spend some time on making this possible in the world that you really live in. So in addition to getting excited about EBP, I want you to get excited about the fact that it really is possible, and we have great examples of how to really make it come true. So we look forward to spending time with you and bringing you EBP for the real world.